today we're going to be talking about proprioceptive neuromuscular facilitation. I'm Chrissia.
I'm Danielle.
I'm Roman.
I'm Nicole.
And I'm Nikki. We started our presentation off with a quote. The basis of PNF philosophy is the idea that all human beings, including those with disabilities, have untapped existing potential. Now this is from Dr. Kabat. He is the godfather of PNF, and we'll learn a little bit more about him later.
Okay, so now we have our educational objectives. Basically, this is what we want you guys to get out of our presentation. First of all, you guys will be able to describe what PNF is and why we use these patterns.
You're next going to list 3 people who helped develop PNF.
We want you to be able to describe what patient population uses PNF.
We're going to teach you how to progress a PNF pattern, and we want you to understand the effectiveness and the outcomes of PNF.
PNF patterns are patterns and techniques of stretching and strengthening. They're a dynamic approach to the treatment and evaluation of neuromuscular dysfunctions. They're based on the principle that motor recruitment can be enhanced by the appropriate proprioceptive input and also the appropriate stretch reflexes. So I know you're all wondering, why do we use PNF? Well, the key word here is function. Basically, PNF are techniques that are used to replicate muscle contractions that we do every day, that we are engaged in every day, and also mass movement patterns. As we have learned in class, PNF patterns always go in a diagonal, or they go in a spiral, and they usually cross the midline, like a lot of things we do every day, like putting on our seatbelt, reaching on a cabinet on the other side, things like that.
So, in the mid-1940s, this is when PNF first started by Dr. Herman Kabat. As we said before, he was the godfather of PNF. His framework of PNF from his influence as a neurologist. So, he began using PNF on patients who had cerebral palsy and other neurological conditions. Kabat was influenced by an Australian nurse who was Sister Elizabeth Kennedy, and she treated polio patients with specific stretching and strengthening activities. Kabat's techniques were also based on Sherrington's principle of irradiation, reciprocal innervation, and nerve inhibition. Kabat's goals was to develop a hands-on treatment approach that enabled clinicians to analyze and assess movement while at the same time facilitating more efficient strategies of functional movement. He wanted to make sure that it was a tool that allowed for simultaneous assessment and treatment for neuromuscular dysfunction. He finally opened up businesses in Washington, D.C. and 2 more in California. In 1945, we had Maggie Knott. She was the first physical therapist to be employed under Dr. Kabat. He wanted Knott to apply these new PNF patterns on patients. She then later began teaching other physical therapists the patterns and techniques of PNF. In 1952, we have Dorothy Voss, and she worked with Knott and Kabat. Voss explained the different methods used to place specific demands on specific muscles in order to elicit a desired reaction. In the early 1960s, we have Voss and Knott, who authored the first PNF book. During the late 1960s, universities offered PNF courses, and it wasn't until the 1970s where PNF stretching techniques were used on athletes and other healthy individuals, and this was to get more flexibility, more range of motion for the patients. So, the 3 of them worked together, and they continued to develop and refine PNF. They combined their analysis of functional movement theories from motor development, motor control, motor learning, and neurophysiology. The ultimate goal was to improve movement patterns.
Okay, so now we're going to look at what population benefits from PNF. So PNF patterns can be used for a variety of injuries, and as Nikki talked about earlier in the history, they're good for a neurological patient population. So these patterns help to assess what kind of functional movement that patient has, and then further facilitates that movement in a functional pattern. So examples that this can be used for polio patients, stroke patients, patients with MS. So now we're going to look at an example of how this is used. So a study in 2015 looked at stroke patients using PNF patterns and pool therapy. So there were 20 patients looked at, 10 in the control group and 10 in the experimental group. So the control group received NDT therapy 30 minutes, 5 times a week for 6 weeks. And so the experimental group received that therapy and PNF patterns in addition in the pool at a temperature of 32 to 34 degrees Celsius and a depth of 100 centimeters. So basically they found that after this therapy that the experimental group who received the PNF pattern techniques, they improved in all the outcome measures over the control group, including the Berg balance test, the tug, and the 10-minute walk test.
Okay, now we're going to progress the PNF pattern. So one thing that you guys can do is use a TheraBand or a weight. You can do the same diagonal directions with the upper and lower extremities. Or you could put something on a shelf or take something off a shelf. Or you can throw and catch a ball. We're going to show you this now.
We're going to look at the outcomes and effectiveness of the PNF. There's a lot of studies that are done on this. I focused on one that was done in 2012, and they found that PNF increases your range of motion by increasing the length of the muscle. It increases flexibility by stretching to enhance the performance and decrease any risk of injury. The third thing they found was that PNF increases strength and power. Fourth, it is beneficial to sub-max exercises over exercises like jumping, sprinting, or cutting. They also found that the effects of PNF lasted longer than 90 minutes. So they found that PNF was done better after exercises than before exercises because it's shown that PNF increases muscle strength, power, EMG activity, and vertical jump height. This may be due to muscles being stretched too much outside their capacity, causing inhibition of the muscles when done before exercises. In conclusion, PNF was started in 1940s by Dr. Kabat. It has improved tremendously since then. There are also courses out there for us as physical therapists to take and to be certified in PNF. PNF patterns are beneficial in the rehab of neuro patients, as we've been learning in class. And overall, that PNF helps in range of motion, flexibility, strength, and restore function, which is the optimal goal for our patients.